Well, that was the Health Secretary talking to us a short while ago. Let's get Labour's reaction to it with the Shadow Northern Ireland Secretary Peter Kyle. And the Bibby Stockholm currently empty. These very serious concerns about Legionella, although mercifully none of those on board appear to have the disease as yet. Would Labour keep it, the Bibby, and barges like it?
Well, let's just be clear about why we're in this mess in the first place. We're in this mess because we have a government that is chasing headlines but is not governing. A government that actually cared about getting the administration of our country right, getting the administration of difficult issues like this right, would have known about what tests to take on that barge before. We knew for weeks that the barge was being prepared for this sort of duty. The idea that they didn't even ask the right questions before putting people on board just shows that what they really want to do is get conversations up in the newspaper but not solve the actual fundamental problems. Now, we're going to have to see what kind of mess we're going to inherit should we win the election next year. We don't know what's going to happen between now and then. We've already had the Rwanda scheme that's been going on for a year. Again, lots of headlines, not a single asylum seeker going through that. We think that's an expensive waste of money that's just inefficient. We said it at the time. They criticised us for criticising it, but look who's been proven right on that. They're using all these gimmicks. They're not solving the problem. The only way we're going to solve this problem is by getting the fundamentals right. That means tackling the criminal gangs that are causing this problem. We want to set up, use the money that has been spent on Rwanda, channel that money into having a new centre in the National Crime Agency that is specifically going after these people smugglers, working much, much more constructively with our neighbours in the European Union and the individual countries through which migrants pass, and also work in-country where the migrants are being driven from because of circumstances, so that we can try and prevent migrants having to flow away from those countries in the first place.
So I note that you don't say that Labour would immediately close these barges. You're accepting that you may have to use them depending on what the situation is when or if the Labour
We are going to have a huge
election.
mess to clear up, not just in the asylum programme, but on our NHS waiting lists, right across the economy, right across our public services. We are going to have an enormous mess to clear up. We will start on day one by making progress on it, but we will move. No, if we'd been running this system in the first place, we wouldn't have had the barges in the first place. Let's get that right clear from the outset. We wouldn't have the waiting lists, the 7.9 million people waiting in the waiting list, had the Labour proposals been used in the first place, and had the trajectory that the last Labour government left the country in been continued with both the economy and public services. We wouldn't have these crises that we see in the economy, in our public services, and also with our asylum system. Each individual caseworker in the Home Office is processing half the number of asylum seeker requests than they were 5 years ago. There is something broken in this system, but let's be really clear, the people who are currently running the country, they broke it.
But Labour must accept that if you form the next government, the boat crossings aren't going to stop overnight. What kind of time frame can you put on stopping these?
Well, we're going to have to see what mess that we have when we inherit.
You're not going to give us a time
Well,
frame?
how can I? Because we don't know when the general election is going to be. Do you? It could be next spring. It could be next autumn. Just take the economy. We've had 4 or 5 budgets now in the last 18 months, one of which blew a hole so big in the economy, it's going to take years to recover from. We don't know whether they're going to do that again. We don't know whether we're going to have more headline-chasing gimmicks that are going to make the problem worse with the asylum system between now and the general election. That's why we can't say precisely how long it's going to take to clear the mess up, because we don't know how much bigger the crisis is going to get in the next year. I could tell you if they call an election next month, which we're ready for, then we can start answering those questions. But we don't think the election's going to come next month, which means they're going to have another 6 months, perhaps a year, perhaps even longer to make the problem worse.
You mentioned the NHS and the various challenges that a new government might face. We asked Steve Barclay about some concerns that the cancer times to get people from a GP to see a cancer specialist could be reduced this week, the actual idea of having a set target. Now, he didn't confirm or deny that the government are going to reduce that target, which means that perhaps people won't see doctors so quickly. But they say they're acting on the advice of NHS England and cancer charities. I mean, do you think having a lot of rules about something like cancer treatment is actually helpful to actually helping people stay well?
Some targets work. And what we're seeing is NHS England is now reviewing with a view to actually scrapping some of the targets. Now, Steve Barclay says that NHS England is independent, but the reason why NHS England is being forced to revisit some of these targets is simply because the NHS has been so poorly managed by Steve Barclay himself and successive Conservative health secretaries that they're having to respond by being honest about the fact that they are so poor at meeting these targets and they haven't met them for so long. They're trying to rethink the system altogether, not to rethink the system in order to make it more efficient, to rethink the system in order to adjust to the new normal, and the new normal is waiting a very, very long time. There is a staff crisis in the NHS. We can't solve the fundamental problems within the NHS until we actually get the workforce plan that's needed. Now, the Labour Party has a fully funded workforce plan that will double the number of doctors and nurses being trained into the NHS. That's funded by cancelling the non-dom tax status. The government has released its plan, but it's not been implemented, and it's not yet been funded because Steve Barclay has not told anybody where the money's going to come from.
Why then, if Labour have got such a great record on the NHS, is Labour-run Wales got some of the worst waiting lists in the country, the front of today's Daily Mail?
What we saw when the last Labour government was in Westminster and in Wales, we saw waiting lists coming down and we saw almost all of the targets being met. And by the end of 2010, we saw very, very few people waiting more than a month or two for any treatment at all in Wales and across the United Kingdom. What we've seen in Wales recently is the fact that we have a Westminster government which sets the budget for spending on health in Wales, and that's caused considerable problems right across the United Kingdom. So yes, what we need, again, the lesson from the last Labour government, 1997 to 2010, is that when you have a Labour government in Westminster and there in Cardiff, then we can tackle these problems. What we have is dysfunction in Westminster, and that is infecting all corners of the United Kingdom.
Peter Cowell, Shadow Secretary of State for Northern Ireland, thank you.